got chat. I think this will work. I'll just wear my fleece so that I cover this up a little bit. So it's a little less unprofessional looking.
Silly question, is the microphone on the camera?
Microphone is on the camera. All in one for hopefully fewer moving parts and pieces.
I have to hang on for dear life. Kidding.
You can put them next to each other if you wanted to, I guess.
Actually, they're a good height
Okay.
for me.
Let me just pull
It's
up.
okay to have shoes on? Or would you rather me not?
Oh, yeah, of course.
Okay.
Absolutely. Don't take your shoes off.
My feet don't stink.
Oh, I believe you. But I don't want you to be standing barefoot on those pads.
I've
Let's
socks.
just see. Does this like say that we're live or anything like that? I wonder.
I don't even know if I have notifications anymore because
Right? It's been so
I've done
long.
it for so long.
Yeah, it says we're live.
Nice.
Okay, good. Well, we'll go ahead and launch it here. If that's okay with you.
Yeah. Either I have to move closer or you have to move closer. Now they know my secret. There we go.
I have no idea if we're good or not. Hey, we are! Professional.
Yes.
That's me.
Well, we're rusty. It's been a while.
It has been a while. It has been a while. Okay. Well, I believe we're live. I gotta stay in close here. Okay, yeah. We're trying out a new hardware setup. So if you're watching this and this is not working well, please let us know. We'll change things around, but hopefully you're able to see us, hear us, and interact with us too. We've got chat, should be live if you have any questions as we go. It's been a little bit since we did a podcast episode, and I apologize for that, but we've been busy, as most
Life
people
happens.
have. Life does happen. Yeah, there's a lot going on. So what we're going to do today is speak primarily towards healthcare providers, and we're going to talk about laser therapy versus shockwave therapy. And the reason I wanted to bring this up is we have a brand new study that just came out this year for this particular subject, but also there's been a lot of providers that have been picking up shockwave machines just in the last couple of years, and it's kind of the new hot thing right now. So we figure, why not go ahead and do a head-to-head comparison? Which one are you going to buy? Because laser equipment and shockwave equipment is fairly expensive, and if you're on a limited budget, which unfortunately most of us are, which one do you spend your money on? Which one do you pick?
And before you get too far,
Yes.
Inquiring minds want to know,
Yes.
because I've been out of the loop just a little bit.
Yes.
What is shockwave?
Yes. What is shockwave? Right. That's the thing people want
I
to know.
mean, I don't want to
for
be
sure.
shocked.
That's yes. So that is something I actually always make sure that I try and tell patients is it has nothing to do with an electrical shock, because that's the first thing people think when you say shockwave. So making sure that we explain, well, it's actually an acoustic wave therapy. And I'll pull a quote actually from today's study. So the study we're looking at today is titled Extracorporeal Shockwave Therapy versus Laser Therapy in Treating Musculoskeletal Disorders, a Systematic Review and Meta-Analysis. Now, this was published just this year in Lasers and Medical Science. There we go. We'll get the link in the broadcast details here. But yeah, what is shockwave and what is laser? If you're new to laser therapy, you need to have a good description for that one. So we're going to give you the healthcare provider side description, and then we'll give you one that's a little bit more something you would actually use to tell your patients. And we'll just pull it straight from the study here. So they say that shockwave therapy is a non-invasive modality that utilizes high-energy acoustic waves, lasting for a microsecond on a target-affected body area. It's theorized to regenerate tissues through increasing the protein synthesis by the mechanical load exerted on the affected tissue. So you're using sound waves to generate a mechanical load on these tissues. They say that it is hypothesized to relieve pain through two different mechanisms. One is that it may stimulate an endorphin release, which causes analgesia. And then another one is that it may actually cause some damage to the nerve fibers, reducing pro-inflammatory mediators and thereby pain levels. And so I don't really like that second one. I don't really like doing damage necessarily to nerves that sense pain unless there's not really another option. But to some degree, I think the patient-facing description of this one is probably a little more simple. Basically, you're using sound waves to impact damaged tissues, and you're both desensitizing them, which helps to lower pain, and you are stimulating a repair function of some type.
So it's two-pronged.
Yes. Yeah, because if you've had shockwave therapy, you know it feels kind of weird. If you haven't, basically it feels like somebody like flicking a bone, like it's or like a little hammer tapping on your bone, or in the deep tissues, and so that means that it is a little bit uncomfortable generally.
Is it a quick shock or is it just a slow, systematic? I mean,
yeah, no, that's a very good question. So it depends on the device and it depends on the settings that are used. So in a lot of cases, more superficial shockwave treatment, radial shockwave, which we'll describe a little bit more later too. That one is typically more rapid shocks, you know, kind of a pretty rapid fire. And then the focus shockwave, which looks a little more deep tissue, tends to be a little bit slower.
Okay.
So more like a kind of routine, ongoing knocking kind of sound, right? But a little bit lower. But oftentimes you can edit that quite a bit on your shockwave settings, so it really kind of depends on the clinician and which protocols they're following.
Okay.
So that's shockwave, right? Non-invasive.
I was going to say, still non-invasive.
Yeah, even though it is a little uncomfortable. But then laser is a little bit different, right? So they say laser therapies, including both low-level and high-intensity laser, are physical agents widely used with different musculoskeletal disorders. Low-level laser therapy relies on photobiomodulation, which stimulates cellular processes, promotes tissue regeneration, and alleviates pain through a neural blockade, and also reduces inflammation. High-intensity laser is just a higher power version, which operates in those same parameters, right? Same photobiomodulation, but they say it also combines that function with a thermal effect, and it facilitates the ability to penetrate deeper into the tissues, producing analgesic and anti-inflammatory effects. So here at Laser Therapy Institute, we're big fans of the high-intensity laser. You can get more done quickly, and you do have a little bit of a thermal effect, which feels nice. If you're a patient, it feels like something's actually getting done, even though that may not be the primary mode of improvement, producing heat.
Right.
People can tell something's happening, and that
sometimes you don't feel any warmth at all.
Yeah, there can be times even with class 4 laser that you really don't feel that thermal effect at all. The thermal gradient is very, very mild, and there's a lot of people that promote the low energy lasers, the low level lasers, saying that the class 4 lasers produce too much heat, that the heat is extremely mild. You don't burn anything, you don't damage tissues with heat. You get more heat just by standing in sunshine. So, you know, the heat level is pretty mild, and what you're really looking to do is drive that deep tissue effect of reducing inflammation, stimulating tissue repair.
So when would you use shockwave versus just light therapy?
That's a very good question. That's
both.
A question a lot of people are asking. Yeah, and can you use both, right? And which one's better at which, right? Because that all comes into this question of, do I do shockwave or do I do laser? Which one do I get for my clinic? If you have to pick one versus the other, or should you pick either one? So this particular study, though, looked at musculoskeletal disorders. So things specifically like lateral epicondylitis, plantar fasciitis, you know, these musculoskeletal painful issues. That's what a lot of people will be looking at a laser therapy device or a shockwave therapy device for, is pain primarily. There are other things you can do with both shockwave and laser, but let's look at pain first, like which one's best. So they looked at shockwave therapy and laser therapy for a combination of these different conditions. Let me flip through here, get you my next quote. They were able to find 28 randomized controlled trials looking at shockwave and laser therapy for things like lateral epicondylitis and plantar fasciitis, so I mentioned that, but also for myofascial pain syndrome, carpal tunnel syndrome, knee osteoarthritis, shoulder impingement syndrome, calcaneal spur or heel spur, and then also de Quervain tendinosynovitis, which is inflammation of the first compartment tendons right across the top of your thumb here.
Okay.
So that was what all these studies that they looked at and covered, and they said that essentially both were effective. Shockwave therapy and laser therapy were effective. Without boring you with details, you can go read the whole study if you'd like to, but without boring you with the details, they said both of them produced good results, and the only thing that was different at all is that the shockwave therapy and the low-level laser therapy had a minor difference, and that difference, gotta go find my quote on that one too. One moment. It's a good study, it's just lengthy.
Yeah.
So they said no significant difference between shockwave therapy and high-intensity class 4 laser therapy. And then also no significant difference between laser therapy, low-level laser therapy, and shockwave other than the medium-term follow-up. So on the medium term, they had a little better effects with shockwave therapy on quality of life on the medium term.
Okay.
Pain relief, essentially about the same, but it's a quality of life score that was actually different on the low-level laser therapy versus the shockwave. The high-intensity laser therapy scored the same as shockwave.
Was there a difference in the length of time for relief or results?
And so with a randomized controlled trial like this, there's not really a good way to look at that. The individual studies showed some level of differences there, but when you combined everything, there wasn't a significant difference overall on medium short term. And of course, whenever you have a systematic review, you're looking at a whole bunch of different kinds of protocols, a whole bunch of different kinds of devices.
So it's hard to say.
It's hard to say. General effectiveness, they say they're about the same.
Okay.
So that doesn't really help us make our decision on whether or not we get a laser or a shockwave, right? If they're both good, well, if I can't buy both, then what are the other factors? So let's look at things beyond pain.
Okay.
So if we look at other uses for these devices, we can talk about conditions like dementia. We can talk about wound healing. We can talk about things like calcific tendonitis, where you get a deposit of calcium within the tissues.
What about things like neuropathy?
Absolutely. So we already read a statement here that said it may do some level of damage to nerve.
Right.
Right?
Right.
So when it comes to neuropathy or peripheral neuropathy, peripheral nerve damage of any kind, probably not the best to try and damage those nerves further, even if it's just a hypothesis.
Right.
So shockwave, generally, I'm going to say not ideal for nerve regeneration. Would it potentially help with pain? Potentially, because you're kind of blocking pain. But with neuropathy, you want to try and stimulate repair so you have better nerve communication. And laser is the one that has been shown over and over again to be highly effective at restoring nerve function and reducing pain.
Right.
So if you want to look at working on a lot of neuropathy cases, laser therapy is going to be the way to be. That's my opinion. I don't have the much more research than I've already told you on that one. But laser works very, very well versus shockwave for neuropathy.
Sounds right.
Right? Yeah. That's where we're at right now. You can argue with me if you want. Please do. But that's mine. That's my my take on it when it comes to especially neuropathy with either numbness or weakness. You know, if you're not focused on pain, then you want to be using a laser. Now, what about things like wound healing?
I'm curious about that and even dementia.
Yeah, for sure. So shockwave has not really been studied very much on the brain, and in fact it is contraindicated to use on the brain for very high intensity settings. And so there's just not a lot of data yet on shockwave for dementia. I don't like the idea of putting shockwave into the brain. You don't really have a specific target, and you've also got the skull. And sound deposits extremely well when you have tissue density changes. So when you go from, for example, soft tissue to bone. So a lot of the shockwave energy is going to be dissipated by the skull. Even with a like high penetration focused shockwave type unit. With a focused shockwave unit, usually you have a very, very large handpiece, and what that does is it enables you to focus that sound kind of into a cone shape, so that the deeper into the tissue you go, the more focused it is. with a radial shockwave unit, that's the other type, it's more focused on superficial. So it more comes down from that handpiece and spreads out as it goes into the tissues.
Okay.
So that can work really well if you've got something that is superficial. But if you have anything that's deeper tissue, you know, the focused shockwave does seem to be better. When they've been compared head to head, usually focused shockwave is better. They're also more expensive though.
And is that what you'd use for the wound healing?
So shockwave really hasn't been looked at very much for wound healing.
Okay.
But you'd want something to be very superficial, right? So the radial type
Right.
shockwave would be probably the thing to use. But then you're playing with the wound bed because you have to be directly on the tissues.
Oh, gotcha.
And,
Okay.
you know, that's...
Could be a little tender.
Could be tender, absolutely. You might disrupt some of the wound healing. Potentially, we just don't have a ton of evidence for it yet. Working the tissues around that area to like increase blood flow and things like that, that might be useful. But again, we don't have a ton of science. Do we have a lot of science on wound healing for laser?
Yes.
Yes, we do. So if you're going to focus on laser, on wound healing, laser would be the machine I would buy for that one too. Dementia, same thing, because we've got a bunch of science now, a bunch of studies have been done on this, both the safety and the effectiveness of laser therapy for dementia, traumatic brain injury, post-stroke, all of it, and it all looks good. So if you're looking at dementia, again, laser is probably the way to go. Now, how about this one? Calcific tendonitis in the shoulder.
You would think that would break up the calcification.
Yes, that is actually one of the goals of providing shockwave treatment to something like a calcific tendonitis in either the shoulder or the hip. It does seem to work pretty well. There's at least one insurance company that will even reimburse for shockwave treatment for calcific tendonitis, rotator cuff tendonitis, as long as it's gone on for, I think, 6 months. So, you know, there's enough evidence there to say, yes, that's good. So if you work on a ton of bone spurs, calcific issues, shockwave could be a great machine for you, I would say. Laser does not do nearly as well for trying to break up calcific deposits.
It seems like it would take a lot longer.
Yes, I've seen it work a few times. Yeah, but it does take a long time and repetitive treatment, whereas shockwave kind of is made more for that.
Yeah.
Because you can be right on it.
Yeah, it actually makes sense.
Yeah, right?
So,
Shockwave.
yeah.
You can break up that
Break up
calcific
that.
deposit. So that's a lot of the big categories. Anything else you can think of that, you know, would be a this or that kind of a condition question? Beyond pain?
Beyond pain. I think that has answered a lot of them
Yeah.
that I've had. I'm sure I'll come up with something afterwards,
Yeah.
and you know, people can put those questions.
Yeah, if you
also in
have
the
questions
chat.
or other thoughts, you know, what's
Yeah.
best for these different conditions, put it in the chat
Definitely.
for sure.
Get information.
The only other one that I could really think of was things like irritable bowel or inflammatory bowel disease of any kind,
Okay.
or
That
any kind of
hadn't even
lung
occurred to me.
tissue
Yeah.
issues like COPD or idiopathic pulmonary fibrosis. So you don't want to use shockwave over any air-containing organs.
Okay.
So the bowel, the lungs, you don't want to be using a high-energy device, at least over the lungs or the bowel. So really kind of rules shockwave out for that.
Okay.
But laser, we know, is a good tool for anything inflammatory, even in the deep tissues in the organs.
So what about, you know, bladder issues or?
Yeah, that's a
things
good
like
question
that?
too. So bladder is a fluid containing and should not be an air containing space. So if you had, for example, some level of scar tissue or calcific deposit, potentially that could be something you could target with shockwave. But we, again, real short on the science for that.
Right.
We have a little better scientific base for laser therapy for some of those disorders, though, for things like interstitial cystitis. So I'd probably still lean towards laser for that one.
Okay.
Yeah, good. So let's talk about some of the limitations then, because this is kind of the last step. So if you're going to figure out, like, you know, your use case, are you using it primarily for pain? Are you using it for specific conditions? You know, the machines are about the same price, really, I think, for the most part. Lasers and shockwave machines are about the same price. If you get a good one, they should all be reliable. And the upkeep on shockwave and laser therapy is pretty minimal. You know, you don't have a lot of maintenance you have to do. But there are some limitations to both shockwave and laser therapy to add into our little calculation matrix here. So if you treat a lot of dark-skinned patients, it's going to be more difficult to get enough laser light past the melanin of the skin and have good results. Whereas with shockwave, doesn't matter what color the skin is, how much melanin content it has, it's going to function just the same. You're going to still be able to deliver that energy to the same depth with no change between your light-skinned patients and your dark-skinned patients.
That's because the dark-skinned patients, the light is absorbed more by the skin.
Yes.
So it feels more uncomfortable, and it's harder to get the treatment complete.
That's exactly
Is that
right.
right?
Yes.
Okay.
Like wearing a dark t-shirt out on a sunny day,
Mm-hmm.
you're going to feel more heat,
Right.
but it's also blocking more of the light. Yeah, yeah, exactly. The other thing, similar vein there, tattoos, right? We can't really use laser over tattoos at all. And if somebody, we see more and more people with tattoos. Oh no. More and more people with tattoos, and if somebody has a full sleeve and they have, say, lateral epicondylitis on that elbow, well, you may not really have the option to use laser for that.
Right.
So that's where it might be good to have a Shockwave device on scene. So depends on your patient population for
Right.
those two items, I think.
That's a good point.
Joint replacements. So an artificial joint, like a total knee or total hip replacement, that was something that you don't want to use Shockwave on.
Really? Okay.
Yes.
So even someone has partial plates and screws in a wrist or an elbow.
Yeah.
Same
Yes,
thing.
any kind of hardware in the
Okay.
bone. There's a theoretical risk that you could actually loosen the hardware in the bone,
Interesting.
and so you would be restricted on what you can really do. If somebody has a total knee, total hip, or plates and screws, things like that, you don't really want to be applying Shockwave over those areas.
Okay.
What about laser, though?
It's not. It's very effective still.
It is,
Because
absolutely.
it doesn't absorb the warmth, or there's no absorption, and it really doesn't. From what I remember,
Yep.
it doesn't reflect either too
Right.
much.
Yeah, it really doesn't have any interaction with the laser at all. It doesn't heat the prosthesis up. It's completely safe. We've done that for years for people, and it's been completely fine. And it's a great option. Laser therapy specifically is a great option for people with post-op pain from a knee replacement. And you would not want to be doing that Shockwave.
Well,
with that.
and scar tissue healing.
Oh yeah, scar tissue healing for sure, especially somebody newly off of a surgery. Yeah.
Right. Right.
Active infections, acute infections, that's something that is a contraindication for Shockwave as well, whereas laser therapy is not. You can actively treat directly over an active infection. Obviously, that's not the only management solution you should be using for an acute infection, but if somebody's already, say, on antibiotics for a joint infection, are you able to laser over that? Absolutely you can. It should help with the pain, but it also may deliver more medication more quickly because you're increasing blood flow to that area, but you're doing it in a very safe way, whereas Shockwave is too disruptive to the tissues, and it could be risky.
Okay.
Pregnancy is one that is a contraindication for both Shockwave and for
laser.
laser. Yep, you don't want to apply either one over the tummy or the low back for a gal who's pregnant. So just pointing that one out again. But both devices can be used on a pregnant person on somewhere that's
Other
away from the
areas.
fetus. Yes. I will just say that emotionally, the loud sound of Shockwave can be a little more unsettling for the patient, even though it's completely fine. And laser is not worrisome at all. So if you're going to use your Shockwave device on somebody who's pregnant, just make sure you talk through the kind of loud sounds and make sure the patient's okay with that loudness. And they may be concerned for their baby. If they are, I mean, obviously, easy solution, switch them to laser if you can.
And I'm looking at his list, but you don't have
Yes.
this one on there. What about cancer?
Yes. So cancer is a contraindication for both.
Yes.
Still at this point. Now, can you treat an area of the body that is not affected by a tumor? Yes, you can. So if you have, for example, a prostate cancer situation, but you're treating the patient for neck pain, as long as you don't have malignancy, you can use either one of these devices for that. Yeah, that's a good question. Last one I have is kids. If you have a pediatric practice, don't get Shockwave. You don't want to be using Shockwave over open growth plates. We don't have enough research at this point to say that it's safe. So if you've got anybody who is not skeletally mature, including maybe sometimes your 18, 19-year-old guys, males, they are not candidates for Shockwave therapy. For laser, absolutely. We've got enough data that we have known for years now that it's completely safe to apply laser over an open growth plate with no risks at all that we know of. but Shockwave is still a contraindication in kids.
Interesting.
So if you got a lot of light-skinned patients who aren't kids, and they've got a lot of joint replacements, so we're talking definitely an older demographic. Laser's probably a more useful tool. If you got a lot of sports injuries and like college athletes and lots of tattoos or lots of dark-skinned patients, Shockwave actually may be a better fit for your practice. And really depends on what else you want to do with it. Is your focus pain? Or is your focus maybe things like wound healing or neuropathy? Like there's all kinds of different scenarios there. So it really does come down to your practice, what your limitations in your patient population are like, and then kind of what your goals are. If you can get both, I say get both because they have their own things they're good at. But if you're limited to just the one, look at what your practice needs.
Good points.
Good. That was the goal.
Yeah.
Hopefully we'll be back in just another couple weeks or a month or so, and we'll be highlighting some more research. If you have questions about this information, this research, or laser therapy devices, please go to our website, lasertherapyinstitute.org. There's a ton of information on there, completely free. You can also email us if you need something in particular, info@lasertherapyinstitute.org. We'd be happy to chat with you.
Sounds good.
Cool.
Okay.
Thanks,
Good to be
Christy.
back.
Yeah.
Good to be back.